the post-transplant MRD monitoring was undertaken in the UK FIGARO trial. This was a randomized control trial of reduced intensity condition regimens. This was recently reported, the final outcome, and what we wanted to show in the abstract in today's ASH presentation was that both pre-transplant and post-transplant MRD monitoring is important in patients with AML. And we've previously shown that pre-transplant MRD is highly prognostic in patients undergoing transplants for AML. But here we show that irrespective of the pre-transplant MRD status, post-transplant MRD monitoring still has an important prognostic and clinical place in the management of these patients. And then what we also went on to look at was what other determinants there might be of the outcomes of patients with post-transplant MRD positivity. And two interesting factors came out. One was the impact of Tcell chimerism. So Tcell chimerism can perhaps be seen as a surrogate of graft versus leukemia effect. And we showed in this data set that patients with mixed donor Tcell chimerism are increased risk of post-transplant MRD, and that patients with mixed donor Tcell chimerism and post-transplant MRD do particularly badly post-transplant. And the second aspect that was of interest in this data set was that in recent years people have shown that HLA DR downregulation is an important mechanism of the leukemia blasts escaping from the immune system. And here we show that the patients with downregulated HLA DR blasts have a particularly difficult post-transplant course of increased relapses if they also have in the post-transplant MRD positive group. So in summary, this data set really shows how important it is to monitor patients post-transplant MRD, and we use the flow-based MRD, but this has been shown in a number of other modalities, and this is irrespective of pre-transplant MRD, and we show an important role for Tcell chimerism in this data set.